Thanks for having me tonight. It's a
Sir.
privilege to be able to talk to you. I wish I had better news. I do not. And I come to you with a level of sadness, profound sadness for what we're seeing happen in Franklin County and across North Carolina. The Delta variant is unlike anything that we've encountered before. And I just got off the phone with the school district today, and they are definitely seeing it. I'm going to go through some things that were not included in I send you all weekly the COVID dashboard that you can look through. But I'm going to go over some things that are new today and some things that are culled from that and expanded upon so that you can get an idea of what we're dealing with at the health department and across the county and what your constituents are dealing with. As I mentioned at our August 2nd Board of Commissioners meeting, the fully vaccinated rate, while improving since that August 2nd meeting, has only gone from 41% to 44%, okay? To get to herd immunity, we need 70% of the population, not 70% of the adult population, 70% of the population, because kids now can get and transmit that, but most kids can't get the vaccine. So we need a higher percentage of adults vaccinated. Our unvaccinated rate is at 56%, which is also too high, and unfortunately is filled with some young people who are too young to receive the vaccine and some who can't get it because they have medical conditions, but overwhelmingly it is filled with people who are eligible and are not getting the vaccine. Testing, which has been below our goal, had been below our goal of 5% of the population per month getting tested. That works out to about 116 tests a day. That was what was happening at the last time I spoke with you. Now it ranges from anywhere from a low of 2 times that amount up to 6 times that amount. One day this past 2-week time period, we had over 700 tests done in a day. That's something we never saw, not even during the surge prior and earlier this year. And it's forced us as the health department to have to actually resume our testing program, which is detracting from our efforts that we have to engage into plan for the booster shots, which we're going to have to give on September 20th. So, and that came at a request of local providers who are just pulling their hair out, not being able to test people and sending people away from their lines. Our county cases, which had slipped to about 5 to 10 per week at the end of July, have risen exponentially. We are now averaging, over the last 2 weeks, we have averaged 280 cases per week. At the peak of the last surge, we were at 400 cases per week. So we're almost to 300, and this is showing no signs of letting up, and as a matter of fact, it's showing signs of accelerating. The Delta variant, unlike other strains, is infecting younger people and children, as I mentioned the last time. So much so that over the past 3 weeks, we've seen the percent of total new cases that are children ages 0 to 17 go from 26% 3 weeks ago to now 31% of all new cases. We will soon be documenting a cluster at least one school, most likely more by the end of this week. Keep in mind, a cluster is 5 or more cases directly attributable to the school setting. We've already have one cluster that will also be documented in the report that NCDHHS releases next Tuesday. We are in daily contact with most schools and have received additional funding from the state to hire a full-time temporary consultant to take on the increased demand of constantly interacting with the school districts around quarantining and isolating orders for kids and their families. The Delta variant is much more transmissible, as I mentioned, and that's due to adaptations that it's been making. And you know, the really significant thing about this is that it's also managing to infect more people who are actually vaccinated as well. New testing requirements, because of this increased transmissibility of the Delta variant, are now advising that all unvaccinated people who are a close contact to a confirmed positive individual have to immediately get tested and then begin their 14-day quarantine period. If they show symptoms, get tested again. If they don't, get tested again 3 to 5 days later. Because the Delta variant shows a very quick progression, and we really need to get the early detection of asymptomatic people. And that's why we're recommending people get tested immediately, which is also compounding our testing demand in the county. Franklin County, along with the entire state of North Carolina, is rated as high by the CDC for transmission of COVID-19. That's their worst ranking. The entire state, all counties have that ranking. We are seeing an increase in the number of positive cases, as I mentioned, among the fully vaccinated. Now, when vaccines first came out, they were, as advertised, 94 to 95% effective at preventing the onset of symptomatic COVID, preventing the infection, which means if you do the flip side of that, 6 to 5% of the people that have been vaccinated could still get it, but 100% of those people were not ending up in the hospital, were not having severe illness, and none of them died. And that was from the initial research. None of that research was done on the Delta variant. It was all done on the initial strains. It was all done on later on in follow-ups looking at the Alpha variant. The Delta variant is not the same animal. And what we're seeing now is there are increasing numbers of people who are having breakthrough infections who have been fully vaccinated. We can't get a number from the state. We are trying to compute it ourselves. I got a number for 1 month. In 1 month alone, there were 47 breakthrough infections. That's a significant number from where I sit. That's not to say that people shouldn't get the vaccine, because none of those people ended up in the hospital and none of them died. So that is an incredible marketing tool to say this vaccine is, as advertised, completely effective, and over now 6 to 8 months almost, very, very safe. So we are seeing that, okay, I already mentioned that. So in summary on where we're at right now, with our slightly increased vaccination rate, Franklin County's rate remains below the 70% required for herd immunity, and the Delta variant surge is showing no signs of letting up in our county. Okay, we're firmly in another surge. When you look at the notes that I'll send you all in for next agenda, you'll see a little Excel graph that I did, and you're going to see a line that goes like this, sharply rising up. This is Franklin County. It's not the state, it's not Mecklenburg or Wake, it's us. Franklin County recommends that everyone within any public building in Franklin County, regardless of their vaccination status, should continue to use face coverings at all times until further notice, except when they're eating or for exceptions allowed by the NCDHHS and the NCDPI guidance. We also recommend that social distancing continue to be followed at a minimum of 6 feet whenever practical. Businesses are strongly recommended that even with fully vaccinated employees, that masks be worn at all times while indoors. Keep in mind that close contact to an infected individual is now defined as anything where you were closer than 6 feet with an individual, regardless of whether you were wearing a mask or not, for 15 minutes or longer in a 24-hour period. So if you go into a business, talk to somebody at the front desk for 5 minutes, go back, come back out for lunch, talk to that same person for 5 minutes, go back and say 5 minutes more at the end of the day when you say your goodbyes, that person is now a close contact to you, and vice versa. And that's COVID, that's the Delta variant for sure. We know we have metrics that I've already talked with you about at the last meeting about when we can back off some of our recommendations. Vaccinations right now can be obtained at the Franklin County Health Department, as well as CVS, Walgreens, Walmart, Family Pharmacy, Youngsville Pharmacy, Impact Urgent Care. And although Impact has reduced their vaccination hours to accommodate increased testing demand. So they backed off their testing, and we worked with them to say, we'll pick up on vaccinations if you pick up on testing. Well, now we're having to pick up on testing too. Booster doses, which is a topic that's been coming up quite a bit lately. At this time, booster doses are only available to those with immune compromising conditions or those on immunosuppressing medications. And for those people, they can get it as early as 28 days after their second dose. It's been approved for Pfizer and Moderna, and so that's where that is right now. Now, the federal government has announced that everybody will be eligible for a booster shot, and by everybody I mean Pfizer and Moderna, at 8 months from their second shot, starting September 20th. And if you look at when people started being able to administer the shots across the United States, that's 8 months from when most people's second doses were. We, as the Franklin County Health Department, which provided most of the people with those early vaccines, are having to gear up to provide vaccines to about 17,000 to 18,000 people. Now, some of them will likely go to other providers because we're not the only game in town now. But a lot of them will come to us because they got their first two with us, and they're gonna naturally reach out to us. And so we have to make plans for that. We've reached out to the state to ask for a National Guard, our National Guard unit to come back. We were told that there's no such force available. And so we have received a couple of additional staff from CCNC through the Web EOC. At this point, there's no recommendation for a booster shot for Johnson & Johnson. That's because Johnson & Johnson didn't start being administered until March of this year. There's not enough data yet to support whether or not there's a need for a booster for that. They are investigating it. It'll probably come out with a recommendation soon.